Hello, my name is Mallory Carranza, and I will be doing my persuasive speech on the importance of prenatal testing. The purpose of this speech is to educate the audience in regards to prenatal testing. I will be discussing the difference between screening testing and diagnostic testing, and then we will also talk about the different types of testings during the first and second trimester. Okay, so let's get started. So pregnancy is a beautiful yet stressful thing at the same time, right? I know some of you are moms and you guys know exactly what I'm talking about. I've been working as a medical assistant for an OBGYN office for almost 10 years now. And we discuss the importance of prenatal testing and we give them different options and all that stuff to our new pregnant moms. Um, I, in 2019, had a niece who unfortunately was detected I'm sorry, not detected, diagnosed with trisomy 13, which is an extra pair on the chromosome pair 13. And trisomy 13 is lethal. Unfortunately, my niece did pass in utero. She passed away at 34 weeks gestation. And I remember when my best friend was pregnant, she was, offered and given all the information in regards to prenatal testing, but because she was young and my cousin was young also, and they didn't have any family history of Down syndrome or things like that in both of their sides, so they just opted out of the testing. Um, Unfortunately, my best friend found out about my niece's genetic defect um at 28 weeks gestation due to an amniocentesis that was ordered for her, which I'll explain in a different slide. Um, but yeah, so the genetic testing is offered as early as 10 weeks. So to avoid finding out kind of late. So, although we know that more than half of the time babies come normal, it is important to just know your options and the testings that you can do just to know the health of your unborn baby. Um, let's see. So things to consider, and these are things that I've kind of like picked up on from like listening to my physicians talk to their patients. Because a lot of our new pregnant patients at their first appointment are super overwhelmed, right? It's so much information, so many things that they have to kind of keep track of. And when you offer the Down syndrome or prenatal testing, they're always like overwhelmed and don't know what to do. And they're always like, okay, well, doctor, what do you recommend, right? So the doctors do tell them like, okay, so what will you do with these test results, right? So say, for example, you have an abnormal test of like a certain genetic defect that can be lethal to your baby. Like, is it going to change the way you continue your pregnancy? Because some patients do want to know, because if there's a lethal genetic defect, sometimes they opt into terminating pregnancy. Or if, they have a baby with Down syndrome, do they consider terminating the baby or just continuing, with their pregnancy, already knowing and being aware of the defects that their babies has, right? Me personally, if I was pregnant, I definitely would get the testing done, not just because of my past experience, but because of the things, just to be like prepared, right? So like, when if you find out, like if I would find out that I had a baby with Down syndrome, it makes it easier for me to find support groups or find school districts with good teachers and things like that, right? Another thing is, will the testing shape your prenatal care, right? So there's sometimes that some tests do detect problems that can be treated during pregnancy, or sometimes in other cases, some prenatal tests do alert about other conditions that can be treated that need to be treated immediately after birth. So, screening tests versus diagnostic testing, right? So, screening tests are to evaluate the risk of a genetic problem. So, it gives you like the likelihood of your baby having like a genetic defect or a genetic disorder. Screening tests are non-invasive, so it's usually blood from the mom or like an abdominal ultrasound or well of the fetus. And then screening tests are offered to all women, right? Diagnostic testing, they're a little bit more invasive. So it's to confirm or rule out any genetic issues. And diagnostic testing is only offered if there's like an abnormal screening test, right? So if you see this chart right here, things have changed since this has been done. Things are a little bit more less complicated. So in the first trimester, we used to offer two things, and in the second trimester, we used to only offer like one test. So the first test in the first trimester, this is 9 weeks, but it's 10. Only because after the 10-week mark, I think there's more fetal blood in the mom. So you would do the first blood test between 10 weeks and 13 weeks. And along with that, you would do an ultrasound called the nucleotranslucency ultrasound, which is an ultrasound of the back of the baby's neck. So those together would give you one result. And then in the second trimester, they would offer the AFP, which is the alpha fetal protein test. And that was done between 15 and 20 weeks. And those three things together give you one result, right? And that's a screening test. So now we offer this testing called NIPT. So it's called non-invasive prenatal testing. And that tests for what these together do, right? So they test for Down syndrome, they test for trisomy 18 and trisomy 13. That test for other chromosomal abnormalities like Turner syndrome, which is lethal. I can't say this right. Klippenter syndrome, and then triple X syndrome, right? And all these tests are screening. The only diagnostic testing is the amniocentesis, which is a little bit more invasive and sometimes can cause a miscarriage. So what it is, it's an ultrasound guided biopsy. So what they do is they use a needle guided by an ultrasound where it goes through the mother's abdomen, and it gets a sample of the amniotic fluid. So that will give you like that will confirm or rule out any genetic disorders, right? So the NIPT now, you can do that testing as early as 10 weeks. And the advantage of that testing is that now it gives you gender. So you can know your gender as early as 11 weeks of you then know the gender of the baby as 11 weeks. I also saw in John Hopkins, the website is that they also offer an ultrasound of the baby's nose. I guess that can show like if there's a baby with a genetic defect, which is interesting because my niece, she had her nose was a little bit different. So I think now it makes sense as to why they offer that ultrasound. But yeah, so being that I've worked for an OBGYN for that long, there's a lot of things that I have seen. And then just from my personal experience and seeing what my best friend and my cousin went through together with their first baby. I think it's very important to just know the different types of options you have and the things that you can do just to kind of keep track of your baby's health so that you're not stressed out and you don't find out till the end like my best friend did when she found out at 28 weeks, where she could have found out way sooner than that. And I mean, regardless of what she would have done, at least she would have been aware. I kind of felt a little bit traumatic where she found out at 28 weeks and then a little bit less than 10 weeks later her baby passed. So I think it is very important to just, be in good connection with your OBGYN, get all the information that you need so that you have a healthy pregnancy, you have a healthy baby, and then with all that, you have a healthy mind too. And I also wanted to share, right before my speech is over, I wanted to share with you guys a picture of my niece. So this is her. Her name was Stella Ray. And she unfortunately passed on her birthday, August 4th, 2019. And I don't know if you guys can tell, but her nose is a little bit different. And then also I would like to share she had issues with her she had like a little hole in her heart, and she was having issues with her brain along with her kidneys too. So I think that's all related to trisomy 13. She also had she had an extra a little extra toe and an extra pinky in both of her hands. So I have her little foot tattooed on my arm. But yeah, um, so yeah, that's it. Thank you and good night.